Oh my God.
Good morning and welcome to the 2020 Newport Data in Your Backyard, hosted by Rhode Island's Kids Count, Newport Partnership for Families, and Bank Newport. We're gathering virtually this year in light of the COVID pandemic that all of us continue to face. My name is Kathy Charbonneau, and I'm the Director of Community Relations for Bank Newport. I'd like to begin by extending my personal best wishes to you, your families and colleagues, for continued good health in these challenging times. Bank Newport takes great pride in being a member of Newport Partnership for Families. And annually, we look forward to seeing you all at this community gathering, especially the last 2 years when we were able to host all of you at our Middletown Operations Center. I miss not being together in person. However, your virtual presence this morning confirms how we as a community value the partnership for its commitment and continued focus on strengthening the Newport community. Thank you to Kathleen Burke and Lori Turner for your important work with such an engaged network of partners. Resolute that Newport families have access to the resources and opportunities that they need to thrive. And many thanks to Rhode Island Kids Count, who I believe is celebrating their 26th year of child advocacy. The data presented each year in the Kids Count Factbook stimulates dialogue on children's issues throughout Rhode Island, and it brings partners together to develop strategies and solutions to advance the health, education, safety, and economic security of children and families. Many thanks to Elizabeth Burke-Bryant, Executive Director of Kids Count, Stephanie Geller, Deputy Director, and Jennifer Capalbo, Program Assistant, for presenting Newport's data to us this morning. On behalf of Bank Newport, best wishes to you in the coming weeks and months as together we stay safe and healthy with a positive outlook for the future. At this time, I would like to introduce Kathleen Burke, Executive Director for Newport Partnership for Families. Thank you.
Good morning. Thank you, Kathleen, for that very warm welcome and kickoff for today's event, and especially to Bank Newport for its continued partnership and support of this Data in Your Backyard annual gathering. Special thanks to Kids Count for not only today, but for their very informative webinars and communications during these past many months that have been a lifeline for many of us during this challenging educational and community period. We want to give a moment to also give a shout out for our event on Thursday, which will be a deeper dive into the data that we hear and learn about today, so that the Newport community can come together and discuss and come up with some action plans for what we hear today from the presentation. That conversation will be from noon to 1, and we will send a link to all participants on today's call. We appreciate you all for joining us today, and I will turn the attention over to Thomas Brendler of Van Buren Foundation and enjoy this morning's presentation. Thank you.
Hi, everybody. Good morning. Well, thanks to Kathleen and Kathleen, Elizabeth, Stephanie, Jennifer, and everybody at Kids Count for everything that you're doing for children and families, not only in Newport, but across the state. We're huge fans. I was a big fan even before I joined the foundation. You know, what's fantastic about the Factbook is that it not only provides valuable information for us for what's happening right now, but you know, as Kathleen pointed out, now there's this historical record, so we can really look at some of these trends and see how we're doing and see where where the areas are that we really need to focus even more on, and also where we've had some wins. Everybody that I know uses it, and my colleagues at the foundation will tell you that I can't quite think of a single proposal that doesn't use Kids Count information in it, and it's always great because I learned something, and I think it helps them as well. So it's just an incredible resource for everybody on all sides. You know, but I think it's more than just data. I think Kids Count, you know, they recognize that data is not just a product, but it's a process, and it's the start of a conversation. It's not just a list of facts, though it is that, and that is compelling, but it recognizes that data and research and, frankly, asking questions has the power to bring people together, people who might not think they have something in common or maybe be in the same room together ordinarily. I also think that Kids Count's work is particularly important because, and I didn't think I would ever have to say this, but the very value of facts and research and science is under threat. It's in question. And I think the rigor and the comprehensiveness and and also the communication that goes along with it, the sharing of it, the engaging people like they're doing today is so important in our society, and I value it even more these days. I think also that, you know, Kids Count gets that there's power in data and research because data and research help us understand the world around us in its true complexity. And when I think about this in terms of Newport, especially, like the nature and the scale of the challenges that we're trying to address. What can we address locally? What's happening more at the state level? What's, you know, more of a national challenge, and how do we start to understand it and tackle it together? And also that a lot of these issues that maybe don't seem connected on the surface are connected, and their analysis helps us understand that. So what we get is that we as residents and also non-residents get to understand Newport more deeply. And also, especially for non-residents who maybe don't understand the complexity of Newport, are understanding that depth. They're understanding that, for example, Newport faces a lot of challenges that larger cities in the state face, and it's not that's not something that a lot of people are aware of. But I think for me, you know, the most important thing, maybe the most important thing, is that the Factbook and Kids Count help us see people in communities who've been invisible. They help us see each other. And I think that moment when we start to see each other, people we haven't seen before, is where real change starts to happen. So I'm particularly grateful for that. So with that, I'll hand it over to Stephanie. And thanks again to the entire Kids Count team for all your great work, and I look forward to the presentation. Thank you.
Elizabeth, I think you were going to say a few words before I began the presentation.
Yeah, yes, and I'm just trying to start my video. It didn't go the first time. Okay, now it does. Great. Good morning, everybody. I am so delighted to be here today with all of you for this amazing Data in Your Backyard in Newport, which is amazing because we have such a strong set of co-hosts in Newport Partnership for Families. Kathleen Burke, it's great to be with you. And also Bank Newport, Kathleen Charbonneau, thank you so much for your introduction of this exciting event. I am pleased to say we have almost 90 participants on the call. Thank you, each and every one of you, for being with us to hear the latest available data about the extraordinary community of Newport and Aquidneck Island. Thank you for all you do. And before we start the data presentation, I just want to reiterate something that Thomas just said, which is this is not just about data, it's about action. And what's been special about our Newport Data in Your Backyard events for so many years, thanks to the strong and mighty group of child advocates that are here on the island and in Newport County, we just know that this is a unique time for people who are playing different roles on behalf of children and families, whether you're an educator, whether you're a physician, whether you're a nonprofit director, a faith-based leader, all of you are a mighty force. And what we try to do with Data in Your Backyards is to share the data and then, as Kathleen said earlier, really have a conversation about what are the action steps that can be taken. So today you'll hear some things that are going well, you'll hear some things that are maybe stuck, and you'll hear some things that are moving in the wrong direction for Newport's children and families. And I have no doubt that this event will be a real spur to really kick off even more work in Newport to change the numbers in the right direction. I want to say thank you to everyone for being on this Zoom event. I want to note that Representative Lauren Carson is with us. Thank you, Representative, for being with us and for your work on children's policy issues. And I also want to thank Colleen Germain, the superintendent of Newport Public Schools. Thank you for taking time out. We know it must be very, very hectic on the ground in Newport as you are working with children and families to have them safely back at school. So thank you so much for being with us. It is my pleasure now to turn it over to Stephanie Geller, who is our Deputy Director, who will lead us in the findings from the Rhode Island Kids Count Factbook for this community. I also want to say that the Factbook that we're talking about today is available to order on our website at rikidscount.org. Now I'll turn it over to Stephanie, who for so many years has just given us this presentation in a way that is actionable. So thank you, Stephanie, for taking it away.
Wonderful. Thank you, everybody, for coming, for participating in this important event. It's so good to have you all together, even if we are unable to be together in person and we're meeting via Zoom. It's still good to see all of your names and see what a breadth of interest there is in continuing to work together to improve child well-being in Newport. I have always particularly loved attending the Newport Data in Your Backyard and found the Newport community and the Newport Partnership for Families to be really historically so very data-driven.
This meeting is being recorded.
You might have gotten that message that this meeting is being recorded. So just to give you that heads up. We've been really pleased to be able to come and not just show you the data, but know that then you're going to take action to try to turn the curve for children and families in Newport by both looking at data that's troubling and trying to make it better, and by celebrating wins that really all of you are responsible for. So I'm so excited to be with such a large group of community leaders who are working to improve child and family well-being, and hope that the data presented today will help you continue to do your good work together. I'm going to try to share my screen now so I can present show you the presentation I would normally be showing you in person. So just a moment. Okay, I believe everybody can now see the presentation. I can't see you, so it's harder to get feedback. So certainly let us know if you have questions. I want to begin by giving a special thanks or shout out to the Newport Partnership for Families and Bank Newport for hosting this event. We've been working together for several months to make sure we have the right people at the event and focus on the data that's most important to all of you. Let me see. It looks like some people are not able to see the presentation. Let me see if I can figure out what the problem is. Sharing my screen. Hopefully that is better. Thanks for those who gave me a heads up that you were having trouble. So I want to again thank Newport Partnership for Families and Bank Newport for hosting this event. Normally we would be able to give everybody a chance to introduce themselves, but it's more difficult to do that online than it is in person. I just want to say how appreciative we are to have people from so many different sectors, people representing the education area, health, child welfare, basic needs, and how important it is to have the kind of conversations we have when we're together around how we can collaborate to improve child well-being. My presentation will take about 45 minutes. If you have comments or questions during the presentation, you can either enter them in the Q&A box or raise your hand and I will try to answer them during or after the presentation. And I'll make sure to leave at least 15 or 20 minutes at the end for what I hope will be a rich conversation about how we can work together to improve child well-being in Newport and Aquidneck Island. We'll also be posting a copy of the presentation on our website, as well as a recording of this session. So certainly feel free to share it with your colleagues who were not able to attend. And also on our website, you'll find copies of some of the recent publications that we put out that you may have missed, including a publication about child poverty in Rhode Island, school climate, fact sheets on early learning, child welfare, obesity, and more. So take a look at those if you've missed them and want to learn more about those particular topics. So as usual, I'm going to really walk through the presentation following the format of the Factbook. As Kathleen noted at the beginning, this is our 26th annual year, our 26th publication. And we put the publication out. I'm going to, if you can see my picture here, usually at this point, I'm showing you a copy of the beautiful Factbook cover. You can see it on the video screen. And it is really a compilation of data across 70 different indicators in 5 different areas, including family and community, economic well-being, health, safety, and education. And I'll be presenting some key indicators in each of those areas. Obviously, I can't talk about all 70 of the indicators, so this would be a very long presentation. So if I've missed something and you have a particular interest in a certain area, feel free to break in with a question by raising your hand or putting something in the Q&A, or to contact me after the presentation. I'd be happy to help connect you to that data. One of the real benefits of the Data in Your Backyard presentation is we're really able to bring the data to you and talk not just about the state as a whole, but really about individual communities. So where I can, where we have the data available, I'll be presenting data both on Newport and some of the surrounding communities, such as Portsmouth and Middletown. So you can see both trends over time and also see how Newport compares to its surrounding communities. So I'm going to begin by really talking about the first section of the Factbook, which is about family and community. A lot of this data come from the census. If you haven't already participated in the census, or you work with individuals who may not have, there's still time to complete the 2020 census until the end of October. And we have information on our social media as well as on our website about how you can encourage folks to do that. So the data in the family and community section of the Factbook focuses on our last census, which took place in 2010, as well as a survey called the American Community Survey, which is a sample or smaller survey conducted annually. So this data is looking a little bit old, which is why it's really important that we really encourage people to fill out the 2020 census so we can see how our population has changed, how the needs of the population has changed. But you can see really the diversity of the Newport child population, where in 2010, a little over half or 59% of our children in Newport were white, 17% were Hispanic or Latino, 8% Black, 1% Native American or American Indian, 1% Asian, and 14% multiracial or other populations. So we'll see how this has changed and make sure that we can meet the needs of children of all ages, of all backgrounds, of all income levels, et cetera, with additional information we'll be getting from that survey. This is just a little snapshot of how the population changed from 2000 to 2010, and so we can imagine and try to predict what we might see in this coming census in 2020. But we had a fairly large reduction of 31% in the population of white children, a relatively large increase or 17% in the population of Hispanic or Latino children, reductions in Black, Asian, and Native American children, and also increases in those who identified as another race or multiracial, as well as a relatively large, one of the largest in the state, declines in the overall number of children living in Newport. So I'm going to talk a little bit about the economics for children and families in Newport. We know how much poverty is connected to so many other indicators in the Factbook. So first, I think it's really good to always start by just making sure we're all on the same page in terms of defining what we're talking about around child poverty. So every year there is a new estimate of what the poverty level is. In 2019, it was considered to be 20,598 for a family of 3 and 25,926 for a family of 4. However, we all know that that is not enough to meet a family's basic needs. And so it's very helpful that the Economic Progress Institute, one of our key partners, puts out a biannual report called the Rhode Island Standard of Need that looks at different kinds of households and how much it would take for those households to meet their basic needs. And they found in their most recent report that came out in 2018 that a single parent family with 2 young children would need more than $55,000 to meet their needs, which really speaks to the importance of programs that help bridge the gap between income and needs, programs like our Right Care health insurance program, child care subsidies, nutrition assistance through our SNAP program and school meals programs, et cetera. So we had a long conversation about this a number of years ago, but we have a number of different measures of really looking at child poverty in Newport and throughout the state. Because Newport and many of the other cities and towns in Rhode Island are relatively small, rather than looking at a single year to estimate the poverty level, we look at a 5-year average. So the most recent 5-year average we have is for the 5 years from 2014 to 2018. And we see that Newport has 23.3, or almost 1 in 4 children living in poverty, compared to much smaller numbers, 7.8% in Middletown and 4.7% in Portsmouth. In fact, Newport, although not as high as the 4 core cities, those communities with the highest child poverty rates, which include Central Falls, Pawtucket, Providence, and Woonsocket, it is approaching that number. So where it makes sense, I'll also try to talk about how Newport is doing, not just compared to its neighbors, but compared to communities with comparable levels of child poverty. And another important measure to look at is the free and reduced price lunch percentage, which is the percentage of children who would normally qualify for free or reduced price lunch or meals in each school district. And Newport has 68%, or more than 2/3 of its children, free and reduced price lunch eligible, which again is approaching the number for the 4 core cities and significantly higher than both the state rate and the rates in Middletown and Portsmouth, showing that there is a population that is above the federal poverty level, but still quite low income and needs additional economic and other supports. Okay, it looks like everyone getting some nice updates from people that they can hear the presentation better. So thanks for continuing to provide those updates. Oops. So I also wanted to really highlight that we see at the state level, this is state data, not data on Newport specifically, but we see very large disparities or differences in the child poverty rate by race and ethnicity, with the highest percentage being among Native Americans, where almost 2/3 or 63% of children living in Rhode Island who are Native American are living in poverty. Also relatively high rates for Hispanic or Latino children with 35%, 26% among Black children, all significantly lower than we're seeing for white and Asian children. So it's important for us to look at the historic reasons for these disparities and to really look at our nation's long history of structural and institutional racism and discriminatory policies we've seen over several decades in everything from housing to education, and how we can really work together to ensure that all children get the best start in life and the best opportunities that they can. One of the biggest costs for all of us is the cost of housing. So I always like to present information on the cost of housing. It's often more than 1/3 of a family's basic expenses. And housing is considered to be unaffordable or a cost burden if a family is spending more than 30% of their income on housing costs. It doesn't allow enough money left for other important needs like food, healthcare, childcare, clothing, etc. And in the state as a whole, in Rhode Island, a worker would have to earn $31.75 an hour and work for 40 hours a week for 52 weeks a year in order to afford the average rent in Rhode Island, which is $1,651 a month in 2019. The Newport average rent is actually, at least this most recent year, slightly lower at $1,427. But if you think back to those poverty numbers we were looking at earlier, those families who are making $20,000, $24,000 a year, a family of 3 living at the poverty level in Newport would have to spend 80% of its income on rent to pay that much for the average rent. So it really speaks to why we see so many families doubled up with other families, getting evicted, experiencing homelessness, et cetera, and why it's important that we continue as a state to really prioritize greater investments in affordable housing. And I also want to point out, we've been trying to share information on our website and social media also about the recent federal CDC moratorium that allows individuals and families who may be experiencing difficulty paying their rent due to the pandemic to acknowledge, to fill out a form and be protected from eviction during this difficult period. We've also been trying to share information about the various rental relief programs, and these are two extremely important resources during this time when so many people are losing employment and losing income. So in 2019, again, before the pandemic, we saw 279 families with a total of 603 children living in a homeless shelter or domestic violence shelter at some point during 2019. We look at two measures in the Factbook of homeless children. We look at both the number who are in shelters, but we also look at the number who are identified by schools, because the schools have a broader definition of homelessness because they're required to by the federal McKinney-Vento law. So in the 2018-2019 school year, Rhode Island Public School personnel as a whole identified 1,475 children as being homeless. And by that we mean children living in shelters, children living in hotels or motels, unfortunately living on the street or in their cars, and living doubled up with other families because of economic reasons. And in Newport, we identified, the Newport Public Schools personnel identified 82 children as homeless. Another important resource for our very low-income families is the cash assistance program in Newport, which is called the Rhode Island, Rhode Island, which is called the Rhode Island Works program. You can see from the chart that we've seen steadily declining numbers of families who are participating in the program. This has been for a number of different reasons, including changes in eligibility related to immigration status, changes in time limits, et cetera. But this program is continuing to serve 230 children in 128 Newport families as of December 2019. And this program provides important basic needs, including not just cash assistance, but work supports or access to training programs, employment services, SNAP or food assistance, health insurance, and subsidized childcare. We, along with many other advocates in Newport and throughout the state, have been working to try to increase the monthly benefit, which is currently $554 a month for a family of 3 and hasn't been increased in almost 30 years. So if you in your head multiply the $554 times 12, you would see how very low that family's annual income would be, not just below the poverty level, but less than half of the federal poverty level. See if there are any, I want to encourage people if they have especially clarifying questions or comments on any of these issues to please feel free to either raise your hand or to put a question in the Q&A box. Used to being a little bit more interactive when we're together in person, but would love to hear your thoughts if you have other questions throughout the presentation. So just a reminder to feel free to do that. So I'm going to move on to talking a little bit about some of our nutrition programs. And a really important program at the national level is the SNAP or Supplemental Nutrition Assistance Program. We know how much hunger and lack of regular access to sufficient food are linked to physical problems, psychological problems, emotional and academic problems in children, and how much it can interfere with their growth and development. In 2019, there were over 150,000 Rhode Islanders enrolled in the SNAP program, and a little bit more than 1/3 of them, or 34%, were children. Among those children, there were 1,175 children in Newport. There have been a lot of efforts to try to make sure the SNAP program continues to be eligible, continues to be accessible to people as additional families need assistance during the pandemic, families who may have lost income or employment. And there have been, for example, introduction of a program called the Pandemic EBT Card, or PEBT, which puts additional benefits on families' SNAP benefit cards if they have school children, so that if they're not able to physically attend school or attend school in the school building either at all or only on an occasional basis through a hybrid program, they continue to get benefits that they can use at grocery stores, convenience stores, farmers markets, et cetera, to meet their family's nutrition needs. And another important program is the really are the school meals program. And in our fact book for a long time, we've highlighted the school breakfast program, primarily because we've seen much lower rates of participation among people in the school breakfast program than we've seen in the school lunch program. Oops, sorry about that. And we've been trying to highlight a variety of strategies that that different school districts can employ to try to increase participation. Among those strategies have been participating in alternative breakfast service, which can be things like school meals in the classroom, breakfast in the classroom programs, or grab and go programs, which are more common for older children in secondary school, as well as encouraging people to consider the universal school breakfast program, which offers breakfast to all students regardless of income, reducing administrative burden and also increasing access and reducing stigma for families. I wanted to note that so Newport has a lower rate of school breakfast participation than many other communities, with 16% of all children and 21% of low-income children in Newport participating in the school breakfast program. And I know Colleen Germain and others at the school district have talked about some of the efforts they've made to introduce or pilot breakfast in the classroom, at least at the Pell School, et cetera. And I don't know if anyone wanted to talk at all about that. I wanted to just give people an opportunity if they have any comments about that. We could certainly break in and get some comments about that now or at the end of the presentation if that's easier. So it looks like we have a question or a comment from Pauline. Pauline, would you like to unmute yourself and ask your question or make your comment? I think you're unmuted, Pauline, if you wanted to speak. And I also noticed that Superintendent Colleen Germain raised her hand. So Pauline, are you still interested in making a comment or question, or perhaps Colleen Germain would be able to speak? So I think we've unmuted.
Thank you, you did. Thank you, Stephanie. Yes, the breakfast program in our schools, we were doing very well with it at one point. And last year was a very challenging year for us overall in general. Breakfast in the classroom still winds up being a challenge as far as getting the academics in order and at the same time getting the food delivered. But we're working with our food provider, Chartwell's, who's been very helpful. And I believe right now we're making breakfast in the classroom universal for Pell. And at the other schools, we have this year grab and go for the older ones. And we'll see how that works. But it still is something, it's hard. I think when children first arrive, they don't always want to eat. And so we notice our snacks sometimes are more popular than the breakfast. Thank you.
Thanks for that comment. And I know that also there is an effort nationwide and in Rhode Island to ensure that all schools can provide free breakfast and lunch to all children during this pandemic. And so it's an opportunity to make sure that children's needs are met during this difficult time. And also, I suppose, to test out some models that could be continued after the pandemic is over, which I know we're all looking forward to. I know that a couple of other people had raised their hand. Did Pauline Moy or Catherine Gould want to make a comment or have a question? No. And perhaps Colleen had another comment. I know it's difficult to join, more difficult than it is in person when I can see her hand raised, but
Yes, I just wanted to also mention we have in Newport, working with Newport Community School, we have created a delivery system for our families so that we are able to deliver meals, and we will continue that meal delivery as we did throughout the summer. So we're continuing it during the school year too. So children that either are not able to come to school or are in distance learning, they're still able to receive their meals.
Wonderful. Thanks for that additional information. And I see that there's still a couple people who had raised their hand. Pauline, I think you're unmuted. Did you still want to speak? No? Maybe there are technical difficulties. Did anybody else who had raised their hand, Carolyn Souza or Catherine Gould, want to make a comment or ask a question before we move on? Okay, I know this is a little bit less interactive than it is when we're in person, but please continue to raise your hand or enter a question in the Q&A box if you find that easier, and I will try to allow for some interaction as best we can on a Zoom call. I would love to have this be an opportunity for people to talk, to share ideas. I also saw a question from Irene Glasser asking about the barrier to having universal school breakfast in Newport. And I know that's, we have universal school breakfast in Cranston where I live. So I know that's often a strategy taken up by communities that have relatively high free and reduced price lunch eligibility. And only children who are interested can participate. So not everybody gets breakfast, but just those who are interested can get breakfast. And it can either be done in as part of the in classroom or grab and go model, or in a regular cafeteria based program. I don't know if anyone else wanted to make a comment about if Newport has considered a universal breakfast program after the pandemic is over, or in the past, or if not, why. Colleen, thanks again for chiming in.
Okay, yes, Newport has looked at it, as a matter of fact, for a couple of years. And a lot of it had to do with costs. And our business manager, working, I know, with Rebecca Boland, committee member Becky Boland, heads the Health and Wellness Committee. And we have been studying this. As I shared, I believe this year we are at Pell at universal breakfast. We have actually been trying to look at universal meals across the board. But again, it comes down to the costs and what the district is able to afford. But we'll be happy to share more information if people would like it. And I can have my business manager run those numbers for you. Thank you.
Thanks a lot. I'm going to move on to the next slide, but I do appreciate people asking questions, and I will try to keep an eye for raised hands and for questions in the Q&A box. Another important thing I wanted to highlight, this is actually recent data from the Center on Budget and Policy Priorities, which is a national kind of think tank on that focuses on low and moderate income families. And it has really important data, I think, on both the differential or much higher impact the COVID is having on the economic well-being of families with children, where 29% of households with children are behind in their rent compared to 16% of households without children. And also highlights the significant racial and ethnic gaps we're seeing in terms of sort of exacerbating the existing gaps we showed in the poverty slide. We're seeing much more hardship being experienced by children, by Black children, Latino children, and multiracial children. And I also noticed that my colleague, Paige Cautious-Parks, who does our economic well-being and education policy for Kids Count, also wanted to make sure people knew about the importance of continuing to fill out or encouraging their families to fill out the free and reduced price lunch applications, because this waiver that allows all children to get free meals doesn't last forever, and having that information will help schools be able to get reimbursed for the cost of those meals for those who are eligible when that waiver is over. All right. Pauline, are you still trying to get on, and were you able to unmute? Did you still have a comment or question? Okay, well, I'm going to move on. I know it's not as easy to participate as it is in person, and I do apologize for that, but I appreciate those who are trying their best. So I'm going to move on to some of our health indicators. First, I wanted to really talk about the health insurance rate. This has really been a positive story for Rhode Island, where we've historically done very well in terms of both children's health insurance coverage, the percentage of children who are covered, and the comprehensiveness of our benefits. And data just released last month shows things were even continuing to improve in 2019 before the pandemic, where Rhode Island had only 1.9% of children uninsured and ranked second best in the country after only Massachusetts in terms of health insurance coverage. And this is something we all need to keep our eye on as families who have generally been getting employment-sponsored health insurance, maybe losing that coverage when they lose their employment, and making sure that families are connected to Right Care so they can continue to receive high-quality, comprehensive health insurance. We've often talked together about the importance of really looking at addressing the needs as early as we can. So we always look at the number and percentage of children who are born with various risk factors that might put them at risk for negative outcomes. Historically, we've looked at families born to teen moms, children born to teen moms, born to single parents, born to moms without a high school diploma, and those who are low income. Because we know that economic insecurity, when it's combined with some of these other factors, as well as living in racially segregated or under-resourced neighborhoods, can put children at risk for poor outcomes. So here we've presented some data on the 218 babies born in Newport and the number of those that have some of those risk factors. Okay. And thanks, Abby, for your comment about the importance of having flyers and information in both Spanish as well as English. And Pauline was able to ask the question about whether children participate in school breakfast, or do fewer children participate in school breakfast? And yes, that's definitely true. Many fewer children participate in the school breakfast, which is why we've historically focused on that number. And I'd be happy to talk about this more in the discussion portion at the end, or you can certainly contact me. But that's been a reason we've been focusing on some of those strategies for increasing breakfast participation. All right, so continuing on. So when we look at some of those children who are born with some of those potential risk factors, one of the programs that's really out there to try to address needs in the earliest years are evidence-based family home visiting programs. These are programs like Healthy Families America, Parents as Teachers, and the Nurse Family Partnership Program that are really designed to reach out to families who are vulnerable and who need additional support to help their children with language, cognitive, social, emotional development, et cetera. And so these programs are really designed to reach out to families in the prenatal period as well as the first year of life to really connect families to information, parenting information, as well as resources they may need. Family home visitors are often helpful for connecting families to some of these programs like SNAP program, housing assistance, et cetera, often just a lifeline to additional information that families may need to meet their basic needs. And I know Colleen asked the question, does the data show babies born to teen moms and then another subgroup of those who do not have a high school diploma? Yeah, so these are now, the data we're getting now from the health department present that data separately. So it's not showing people who have all those risk factors, but those individual risk factors. Thanks for that question. So there are now, as of 2019, there were 23 families enrolled in these different family home visiting programs. Okay. All right, I also wanted to focus a little bit on children with lead poisoning because Newport does have a higher rate of lead poisoning than many other communities. In the most recent data on children who are due to enter kindergarten this coming year or the fall of 2021 show that 265 Newport children were tested, and 20 or 7.5% of them were confirmed positive. And this is higher than the state rate, and we know how much lead exposure can affect children in terms of their health effects, their development effects, academic achievement, and there are also long-term studies showing that there are long-term effects on reading achievement, et cetera. And we know one of the benefits of our state is the lovely historic homes we have, but the other side of that is that we have many homes that were built and painted prior to the lead paint law changing in 1978. And we know that a lot of the children who live in such homes may be at additional risk, as well as children who spend their time in other locations, whether it's schools, childcare centers, et cetera, that may also have lead exposure either in paint or in their water. And a connected issue, really, again, connected to the quality of housing is asthma. And I know there's been a strong focus in Newport for many years on addressing chronic absenteeism in the early grades as well as truancy in later grades. And asthma is one of the most common chronic conditions among children and a leading cause of school absenteeism. And again, Newport has a relatively high rate of asthma-related emergency department visits with 9.5 per 1,000 children. This graph shows really the differences we see by age and race ethnicity, where again, we see more risk, more asthma hospitalizations and emergency department visits among children of color than we see among white children. And this is some data that just came out. We released a little bit of data on overweight and obesity in the Factbook this year, but also did a special report that came out late this spring about overweight and obesity. And there's a nice map that lets you see fairly easily how Newport and Aquidneck Island compared to other communities. And overall in Rhode Island, we see 13% of Rhode Island children overweight and 17% obese, with a total of 30% of children overweight or obese, and a slightly lower rate of 12% overweight and 15% obese for Newport. And I just wanted to make sure people had noticed this new publication, and if you're working on issues related to nutrition or activity, that you knew about this new resource. Okay. And then also there was a lot of conversation at last year's Data in Your Backyard about children's mental health. A lot of times we pay the most attention to children who are receiving the highest level of care through emergency department visits or psychiatric hospitalizations. But I think an important note is really how many more children are receiving mental health treatment at community mental health organizations, or in fact in their schools. We've seen an increased focus on the mental health of children, youth, and adults, with additional sort of isolation, anxiety, depression related to the situation we're all in COVID. And even prior to that, in 2019, we saw 15% of Rhode Island high school students reported attempting suicide in the past year. And I know there's increased focus on really making sure that children who have experienced trauma, isolation, who may have had a family member who had COVID or who died of COVID are getting those kinds of additional supports and resources in the schools and outside of the schools to address their mental health needs. Oops, sorry about that. Okay, and another new bit of data we were able to share in the Factbook is really addressing what I know a lot of people have been concerned about, which is the increase in e-cigarette use or vaping we're seeing nationally and in Rhode Island. So the most recent data that we had from the 2019 Youth Risk Behavior Survey shows a pretty large increase from 20% in 2017 to 30% in 2019 of high school students reported currently using e-cigarettes or vaping. And here you can also see e-cigarette use and vaping, as well as cigarette use, alcohol use, marijuana, and prescription drug use at the state level, by grade, by race, ethnicity, by gender. And we'll be putting out an updated series of tobacco fact sheets very soon with additional information on tobacco and e-cigarette use. And if you're interested in that topic, I hope you'll look out for that event coming up soon. Moving on to the safety section of the fact book, we've been following for a long time really efforts to look at community-based diversion for youth who may have an offense that maybe can be addressed outside of the court system. And we've been seeing between 2010 and 2019 a pretty substantial decline in juvenile offenses, or 38% decline. And we've also been following this trend during COVID, having conversations through our Juvenile Detention Alternatives Initiative about what people are seeing during COVID. And I know that last year, and when all children were home, there was a noticeable decline in referrals to the family court because a lot of those referrals are related to schools. And we've been trying to raise awareness about the additional support that schools need in terms of additional mental health personnel so that they can address children and youth's challenges in perhaps a way that doesn't involve court if they have those additional resources. And there's a big focus on really providing training and supports to schools so that they are not trying to do it alone, but get supports that they need for children who may be acting out due to challenges in their homes or communities. I think it's also important to note that we, in terms of the kinds of offenses we see, one of the reasons why there's been a strong focus on really looking at other ways to address offenses is that there are a large proportion that are not the most serious or violent crime offenses. Only 5% of juvenile offenses in 2019 were for violent crimes. And the largest number were status offenses, which are really offenses that are only punishable if you're a child and not an adult. And those are things like truancy and disobedient conduct. So we've been trying to work with a number of different partners to look at truancy courts, to look at ways to really ensure that that youth are met where they are and that they receive the supports that they need in the least court involved or least intensive way that makes sense for them. So related to that, we've also seen over the years a very large decline in the number of youth at the training school, 75% decline from 2008 to 2019. Some of that related to this work around community diversion, as well as to efforts to put a cap on the number of youth at the training school. We do provide information on the community that children came from, and in 2019, 2 youth were in the care and custody of the training school who were from Newport. And we have also been in a lot of conversations through the Juvenile Detention Alternatives Initiative with people at the training school around safety protocols they put in place to keep youth safe during COVID, as well as to ensure that those youth that don't need to be at the training school are kept out of the training school or released as soon as possible. And child abuse and neglect, I know, or child neglect and abuse has been a really strong focus for Newport for a long time, because Newport has historically had one of the highest child abuse and neglect victim rates in the state. And again, this most recent year is 3rd highest in the state with 26.5 victims per 1,000 children. So these are, of the 3,100 or so victims, 55 of them were children from Newport. And again, we know that there's been a focus on making sure that we're keeping kids safe, that when children are not in their normal places, in childcare centers or in schools where people may identify that children who may be at risk or experiencing neglect and abuse, that there has been some concern that some of those children may not be identified during COVID when children are not in those settings as often. And we also know that about 80% of child neglect and abuse cases, which is why we've recently changed it to calling it neglect and abuse rather than abuse and neglect, are actually neglect cases. And so that really highlights the importance of making sure that children and families have their housing needs met, their food needs, their healthcare needs met, and that we're providing supports for families so that they can keep their children safe and healthy and address ongoing needs that may be happening in the family around mental health or substance abuse. I'm going to move on to some of the education indicators, which we usually talk about I'm just going to make sure I don't have any more people with their hands raised. Colleen, did you have another comment? I just noticed you had your hand raised.
Oh, no, I do not.
Okay. You might just be still raised from before. I just wanted to make sure I wasn't missing you.
Okay, now it says right. Okay.
And it looked like Linda La Liberté might have had a comment or question. Did you want to make a comment?
This is actually Lee Fan and Linda's busy. I work under Linda, so I attend the meetings representing her. So I'm just wondering, for Newport being the highest in child neglect abuse, what possible reason could behind that?
So I know we've had a lot of conversations with this over the years about whether Newport has a very rich set of service providers. There's been some discussion about whether some of that may be greater identification, but also we do tend to see the highest child neglect and abuse rates in the communities where we see the highest poverty rates. And as we talked about before, Newport is actually pretty high. It has, I think, the 5th highest percentage of children, of low-income children who are eligible for free and reduced price lunch, as well as pretty close to that number, or 5th highest for the poverty level. So those are families that may need additional support. And obviously the goal would be to provide that support to families before it rises to the level of an indicated investigation for neglect or abuse. But I don't know if anyone else wants to talk about this, and I imagine this will be a big topic of conversation for the Thursday meeting that Kathleen mentioned at the beginning of the presentation as well. Did anyone else want to take that question or make a comment? Jamie, I see you raised your hand. Would you like to speak? Jamie, did you want to make a comment? I think you're unmuted.
Okay, I think I just came through.
Yep.
I'm wondering if it's an increase in neglect because so many of our families here are working in hospitality and maybe working lots of hours and they're here in Newport.
I mean, that's definitely true that you have a different employment base than a lot of other communities, and people may need, for example, childcare at times that are not the usual times if they're working in evenings or weekends more often. And that would be something to explore, I think, maybe through the FCCPs to see whether that's, to see if that is a reason why families are being identified, and if some additional resources and supports could be put in place to meet some of those out of usual time childcare needs.
Thank you.
Okay. And I saw that Irene Glasser had a question about whether there was a more detailed analysis that the state of Rhode Island has regarding neglect and abuse. And we have very detailed data on neglect and abuse in the Factbook, including information by age, where we see the highest neglect and abuse rates among the youngest children, as well as information about the type of neglect or abuse, whether it's neglect, physical abuse, sexual abuse, etc., as well as information about children who are in out-of-home placement. So if you haven't already looked at some of that data in the Factbook, I definitely recommend that you look at that, and we'd be happy to talk to you more about those issues. So actually, that was a nice lead-in, Jamie, because I was just about to talk about the childcare subsidies. So we have one of the first indicators we talk about in the education section is really some of the resources are for our youngest children as well as our school-age children, is the importance of families who rely on childcare, both to enable them to work, but also to provide really the enriching early education experiences our children need to prepare them for school. We know how many families need this type of care, both to allow them to work, but also to give their children the best start in life they can, but who may have difficulty paying for it. And that's really the importance of these childcare subsidies that allow low-income families to enroll their children in childcare programs and have a portion of that cost paid for through the subsidy. So this trend here shows really the pattern we've seen in childcare subsidies, which was really we're seeing increased availability in childcare subsidies from 2013 to 2019, as well as, but still way down from the historic peak in 2003. And I know we've been doing a lot of work on childcare during COVID, and I know Elizabeth wanted to make a comment perhaps about that issue or others. Elizabeth, did you want to speak?
No, I think I can, well, yes, I'd just like to say that we know that childcare has been such an issue during this pandemic. It is really just very, very difficult for working parents to be juggling everything that they're juggling. We are very relieved that the state has been able to institute a new rate for childcare subsidies through the Child Care Assistance Program, which was made possible through the CARES Act funding. And that has allowed our rates to increase to the point where they are at the federally required benchmark of rates. So that has been a good support to childcare centers and homes. There was always also a long period of time for counting attendance at pre-March COVID rate of attendance. But we know that childcare across the country has been such a huge issue. It really requires more federal dollars. And it is our hope against hope that another coronavirus package comes through and that we are able in Rhode Island as in the rest of the country to get the help that we need. There are also many issues, as Stephanie said, with people working different shifts, people needing different kinds of childcare. So we, as with all of these issues, we have been advocating hard with many of you. And I also wanted to just note that wanted to recognize Senator Dawn Ewer, who's on the Zoom with us, as well as Representative Terry Cortfriend. Thank you so much for being with us today and for what you're doing at the General Assembly. And now back to you, Stephanie.
Thanks, Elizabeth. So I'm going to move on to talking a little bit about the availability of high quality early learning programs. We've been for a while looking at the quality of childcare and early learning programs through the Bright Stars program. And currently, we're in 2019, there were 100% or all 4 of the childcare centers or preschools were participating in the Bright Stars program in Newport, and 2 out of 4 or 50% of them had a high quality rating. There was 1 family childcare program not yet participating in the Bright Stars program, and our public school program that has a preschool participates but hasn't yet reached that high quality rating. So there's really an effort to really not just rate programs, but provide the supports that they need to grow and get better, whether it's through training of staff, increasing education levels of staff, other kinds of supports. And I know we're all kind of struggling to just, kind of tread water right now, but it's a continued focus to really make sure that early learning programs get the support that they need to provide not just any type of childcare or early learning, but the highest quality. And I know, looks like Joseph Pratt had a comment that understanding the status for 2019, we are noticing more and more families falling off of CCAP either due to unemployment insurance and being out of work, or unemployment insurance funds putting them above the limit. An example of the cliff effect we discussed with working cities, families losing benefits when they need them the most. And I know this has been an ongoing issue with the additional unemployment insurance that families have been getting, putting their income back and forth above and below limits. That's affected childcare as well as SNAP and Rhode Island Works eligibility. And although we know that families need that support, it is an ongoing issue to make sure that when families are losing this, they're not losing, when families are losing employment, they're not losing the important supports that they need for their child and their families. So thanks for pointing out what you're seeing currently around those issues. All right. So another important resource really for young children is is Head Start and our Rhode Island Pre-K program, which are 2 really important programs designed to ensure that children have access to the kinds of high quality preschool programs that help them prepare for success in school. And so we've been combining the data on these two programs for a couple of years to really look at the percentage of children who are getting that high quality learning experience in the year before kindergarten. And at the state level, about 1 in 4 or 26% of all children are getting access to those programs or enrolled in those programs, whereas 45% of low income children are. And we see a slightly different picture in Newport, where we have a higher percentage of all children, or 34% of all children getting access to Head Start or pre-K, but a slightly lower percentage of low-income children in Newport. And that might be worth looking at to make sure that that there are adequate outreach efforts, which I know have been really strong. I've been talking to people about them for many years, but continued strong outreach efforts to make sure that low-income families and families who might most benefit from these programs know about them and have access to them. And here's another issue that we've had a lot of interesting conversations with over the years. Newport has actually seen among the largest increases in multilingual or English learners in the state. So in the 2014-2015 school year, only 5% of children were multilingual learners. And by the most recent year we have data for, or the 2018-2019 school year, 14% were multilingual learners. And we know, that multilingual learners present both opportunities and challenges. It enriches, having diverse groups of children and children who can speak multiple languages can increase the sort of the opportunities for youth to meet children who are able to speak more than one language. But we also know that it's difficult for children to both acquire English language proficiency and to acquire academic content. And there have been, I know, a lot of efforts in Newport to make sure that multilingual learners are getting access to high quality summer learning programs, and that there are increasing numbers of teachers who are certified to teach English language programs. And I don't know if, Colleen, if you wanted to jump in again to talk about this, or if anyone else wanted to ask a question or make a comment about resources either in schools or in the community to meet the needs of this important population.
Thank you, Stephanie. Yes, Newport has seen, and we have been reaching out to the community about a very quick rise in multilingual learners. We are hiring more staff. I believe we hired 4 to 5 more MLL teachers this year. And everything and anything we're doing, we've always made sure for the past 5 years, we have everything in English and Spanish, at least 5 or 6 years now. We do have higher, of course, that are in the district right now. I believe it's about 17% for this year. I'm trying to look up my data as you're speaking, but I'll find those harder numbers as to how many we actually have as of right now. We also, for the public, should know that when we have new enrollment and we have new enrollees into our school system, during these months, we start to screen our children to see what their English language capabilities are. So usually within the next month, we will see how many more students we have that are coming in. We do know, working with community leaders and others, that we do have, again, a population coming in from Guatemala that we've had in the past. So it seems to, at least from the school perspective, it's a lot of families that know each other, or community members from Guatemala that know each other that are coming here to the United States for a better life. But that's all the information I have at this time. I'll look up my other data. Thank you.
Thank you. And I think there might be another raised hand. Did anyone else have a comment or question? Rebecca, maybe? Rebecca Rosen, did you have a comment or question? No. Well, if you're able to hop on in a minute, please feel free to break in if you have a comment or question relevant to what we're talking about. We'd love to get people involved. So I'm going to move on to some of the data on reading and math skills. So I've been fortunate, along with Paige Clashes Parks, to work with a wonderful group of both school personnel and community groups on the Newport's Learn to Read by 3G initiative, and we've been really trying to look at all the issues that feed into children reading proficiently by the end of third grade, including school readiness, chronic absenteeism, access to high quality summer learning programs, and what can be done within the school building, doing things like Colleen just talked about around making sure that there are adequate numbers of teachers certified to teach multilingual learners. Despite some of these efforts, we're continuing to see kind of a stubborn, relatively low rate of children who are meeting expectations in English language arts in Newport. In 2019, there were 27% of children meeting expectations compared to 46% in Middletown, 55% in Portsmouth, and 48% at the state as a whole. And this has been an area of focus for our organization and for the state for a while, because we know that children who are not reading proficiently by the end of third grade are 4 times more likely to drop out of high school. So it's really an effort to, again, reach out and provide the support that we can to children in the youngest years and to their families so that they have the resources they need to be able to achieve that important milestone. Rebecca, are you still wanting to make a comment? Did you want to, you still have your hand raised, and did you want to unmute and ask a comment? Make a comment? All right, well, we'll do our best to keep people involved, and I'll move on. We also have been following the math achievement rates, and here we're looking at 8th grade math skills. And we know how important math skills are in terms of being a potential gatekeeper to access to both employment and higher education, how strongly math skills predict college attendance, success rates, and increase students' employability. And again, we're seeing lower rates than we would like to see in Newport, with only 19% of 8th graders meeting expectations. But I should point out, Rhode Island as a whole is not doing a whole lot better, with only 24% meeting expectations. And there are a small number of districts who are doing better, including the neighboring districts of Middletown and Portsmouth. I know chronic absence has been a big focus with the C3 initiative going on for quite a while in Newport, again, trying to look at both ways to address chronic absence in the early grades as well as the later grades. And here I'd just like to start off by both reminding people that the definition of chronic absence is generally missing 18 or more days of school, or which translates to 10% of the school year on a 180-day school year. And in Newport, 22% of children in grades K to 3 missed 18 or more days of school during the 2018-19 school year. And this rate is both higher than the state as a whole and up from the previous year, where it was 16%. And I know there have been a variety of efforts to address the issue, both talking about raising awareness about the importance of attending school in the early grades, especially in kindergarten, where not all families recognize the difference, the importance, but also addressing what might be the reasons behind the chronic absenteeism, whether that's health issues like asthma that need to be addressed, unreliable transportation, lack of ability to meet a family's basic needs. So like they don't have the right clothing or boots to wear on cold days. They're experiencing instability in housing. Or they're getting bullied, or just don't feel like school is the place for them. So I know this will, again, continue to be a topic of a lot of conversation for the partnership and for the community at large.
Stephanie, can you hear me?
I can.
Okay, sorry, I was having audio issues, and I hope I fixed them. I just wanted to go back to the multi-language learners. We've started an organization called Conexión Latina Newport, which is we put together to support the Latino community within Newport on many fronts. One is with schools. Obviously, I work in the elementary school, but I'm also starting this organization, and we are working with the families on being more involved through the registration process, advocating for themselves, making sure that they're getting the services that their children need. They're very shy people that don't like to ask for things. So we're trying to work with them on how they can best meet their children's needs, as well as assisting them with resources in the community, accessing mental health services, medical health services, any kind of social services. We facilitated a couple of Spanish family forums with Colleen online. We're doing translations for a lot of organizations around the city. So we're really hoping to see some more uptick in the Latino population involvement as well as accessing resources that they need. And I suppose in a year or two, we'll see whether we're successful or not.
Wonderful. Can you just say the name of the organization and how people can learn more?
It's Conexión Latina Newport. And all we have right now is a Facebook page, which is pretty active. And we are working on a regular website, as well as our 501c3 status. So we were growing very slowly and then exploded during COVID. And now we're kind of getting back to the work of establishing ourselves. But the partnership, we're involved with the partnership. I'm on the board. So anybody can reach out to us through that if they need any assistance or advice.
Wonderful. Well, thanks for jumping in with that important resource.
Sure. Thank you. Sorry about the delay.
No problem. All right. So I just wanted to also provide some data on chronic absenteeism at the middle and high school level. One of the interesting things is that Newport's actually seeing a reduction in chronic absence in the middle school, at least was from the 2017-18 year to the 2018-19 year. But that number isn't translating to changes at the elementary or high school level. And in fact, the high school chronic absence rate in Newport is 42%, or the third highest in the state. And I know there have been efforts to reach out to youth organizations like Young Voices to try to really understand from the youth perspective reasons why they might not be participating, and to really incorporate youth voice into that conversation. So I know I'm a little taking more time for the presentation because people are so kindly jumping in and making it a more interesting conversation. So I will try to leave a few minutes at the end. I'm almost done with the slides. And I just noticed it looked like Rob Archer raised his hand. Did you want to make a comment, Rob? Maybe you put your hand down when I told you I was going to
I think you can hear me now. I just wanted to comment on the data for the last year or so that you referenced with regards to the middle school. I think one thing that I would say is if you talk to Jared Canini and folks at the middle school, they would say it's been very intentional in terms of, and this has been really a group effort across the board, that they work really hard at reaching out to every single family when a child is not in school, and making a phone call to that family and having a connection, not a robocall, but a real connection. We do, the Newport schools do a lot of home visiting. Their attendance officer is not, just filing truancy petitions, but is going to, homes and meeting with families. I think that some of the efforts that we've put in place, and obviously right now it's a little bit, they're very unusual what we're dealing with, but some of the things that we've put in place, including an AmeriCorps program that uses the check and connect model, are beginning to bear fruit. But we also noticed, and I had chaired this committee, co-chaired it really with others over the past 6 years. And so we also have noticed some of the upticks in the younger children, and also pretty significant uptick in the high school, which we don't know entirely what that's about, if that's related to some of the English language learners, or if that's other phenomenon that we can't account for yet. But the group that meets on absenteeism and school attendance, which I think is more proper way to talk about it, continues to meet, and has been supported for 6 years by Van Buren. And we're going to, regardless of the fact that the funding is beginning to wind down, we're continuing to meet and work on this issue. So thanks.
Thanks for sharing all those great efforts that you have been making and are continuing to make. I think Colleen might have wanted to jump in with some additional information. Did you have a comment?
Yes, I'm unmuted now. Yes, thank you, Rob, for bringing that up. We are noticing subpopulations of where that chronic absent rate is at the high school. And it does tie into our MLL population, and it also ties into our graduation rate because of families relocating to our community. Most of the young people that are moving in with family members are of the age of 16 or 17, And that's when they have to and they must register for school. And so they actually have come here. We have noticed, and Rebecca can probably share more on this, we have noticed they have come here to help support their families and work. So for those young high school students, and most of them are male, they do come, they register for high school, but then they disappear sometimes on us. And they then turn 18 and they no longer are obligated to attend high school. So I think this presentation is great in the way that it's showing all the different impacts it does have on the school and how people measure success if you just look at test scores. And that's something we're continuing to do outreach with our community members to work with them to help support their families and their children's education so they can be even more successful when they get older. But thank you, Rob, for jostling my brain on that one. But that is something we are seeing in certain populations. Thank you.
Great.
Thanks,
For
Colleen.
that. And that is really great additional context to what's happening. I'm going to try to finish the last few slides so that there's at least a few minutes for some conversation. Usually I've been presenting data on the suspension rate, and I wanted to acknowledge that Newport has seen a pretty substantial decline in the suspension rate from 24 suspensions per 100 to 15 per 100 over the past several years, and is now equal to the statewide rate. However, we're still seeing all of Newport's suspensions are out of school suspensions rather than in school suspensions, and that is different from the state as a whole. And we know how important it is to really look at other ways to address student misbehavior because we know how much suspension can lead to disengagement from school and eventual dropouts. That being suspended even once in 9th grade is associated with a twofold increase in the likelihood of dropping out. So I think looking at how attendance and suspension and multilingual learners' needs connect to high school graduation and eventual higher education pursuit is worth looking at as a group. Here's the latest data on high school graduation rate. You can see that Newport's rate has just dipped a little bit from 84% down to 78%, with the most recent year, 78% graduating in 4 years, 17% dropping out, 1% getting a GED, and 5% still in school. What I think is maybe more interesting to talk about is some of the differences we're seeing by whether it's by race, ethnicity, by disability, a multilingual learner status, or participation in the career and technical education. So I think looking at some of those issues and where we need to target our attention is definitely worth a longer conversation. And I'm just going to go to the last slide just because I am feeling bad that we're not leaving time at the end for conversation despite a great conversation throughout. So I'm just going to end with a positive note in that we're seeing, despite a decrease in the high school graduation rate, we're seeing an increase in those who are then connecting on to higher education, with 62% of Newport students who graduated in the class of 2018 going on directly to college, up from 50% in the prior class of 2017. So I think it's worth thinking about support students need throughout their K-12 years to have the skills that they need, as well as the financial supports and information they need to access higher education, if that's the right path for them. And this is looking like a positive data point that I wanted to make sure to share. And one that I think we should keep our eye on. I assume, like the state rate going up, it's related a lot to access to the Rhode Island Promise Scholarship Program with the CCRI college campus right in your community. And it would be interesting to look at how that changes with the current COVID pandemic and increased economic need, as well as the long-term viability of the Rhode Island Promise Scholarship Program. So I'm going to try to wrap up quickly, just in case there are a couple more comments. Maybe we can go over by just a couple minutes if people have burning questions or comments. But I wanted to make sure people knew that in addition to the data that's in our Factbook and on our website, you can find both the Factbook and the community profile with 5-year trend data on Newport, as well as every other community in Rhode Island on our website. And there's another great resource that the Annie Casey Foundation puts out, which is called the Kids Count Data Center, which allows you to do line graphs and maps and such to look at trends and to look at differences geographically. So if you didn't get enough data in this presentation and you want more, this is a great resource. And I also wanted to let people know that, again, we'll be posting the PowerPoint presentation on our website as well as a recording. All of our recent publications are there as well as a link to ordering the Factbook. And I do apologize for ending exactly at 10:30, but appreciate people raising their hands and making comments throughout the presentation. And I would be happy to stay on a little longer if people have other questions or comments they wanted to end with.
This is Grace from Van Buren Charitable Foundation. I had a question for Colleen, if I may, about these mostly male students who end up coming and supporting their families, understandably and honorably. Do you have any idea where they're finding employment? I mean, are they bussing tables at local restaurants? Are they working on construction sites? Do you have any information around that?
Yes, I do. I don't know if you can hear me.
I can.
Okay, yes. Quite a few. It's a variety, Grace. They're in the hotel, restaurant business, landscaping is one. Mm-hmm. Let me see. Construction. It's all of the above. I think as whether they're joining an uncle or a parent or another family member, they're usually getting employment in those ways. I've actually seen some of the young people and I've told them, you need to be in school. What are you doing here?
Right.
Right. So, and you know, and we try to, I have to say, Tracy Shea with the Newport Community School, we've tried to, and we've actually, in my guidance department, Linda Matoza and Michael Monahan, we've actually tried to set up programs for them so that they can get at least their GED through their programs. If, you know, it's a must that they must during the school day go to work. Now with distance learning and more technology, we've had the discussions of how we can maybe provide, you know, in-school recorded sessions, or maybe have some distance learning teachers at a time that's better suited for them to do both. And we have had some success stories, but it does take a lot of discipline and support for these young people to do both. Do the work, you know, do the job during the day, and then, or quite a few of our students that do come here and walk through the doors at Rogers, my office is over here. They actually work in the restaurants at night. So we can tell, you know, I can see a couple of them in the hallways. They're tired. They're tired, but they make that effort.
It's hard enough for an adult going to school and working.
Right.
So for a child, I can't imagine. Okay, thank you very much, Colleen. I appreciate it.
You're welcome.
Great. A few people have posted questions in the Q&A, and I want to just reiterate that we will be posting the recording as well as the slideshow on our website. And if you have other questions or ideas, certainly feel free to contact me, and I hope you'll also participate in what I'm sure will be a lively conversation with the Newport Partnership for Families on Thursday, with an opportunity to talk about how to make progress as a community in improving child and family well-being. And were there any final questions or comments anyone wanted to make before I thanked you and we all went about our